NHS England and NHS Improvement, together with Public Health England, launched their latest Help Us Help You campaign, NHS Access. The campaign reminds the public that the NHS is still here to help and that the NHS has adapted services in order to see them safely. Dr Israa Siddig tells us more.
As we all know, COVID-19 has dramatically changed the way we work, the way we provide care in the NHS services. Some of these have been positive, believe it or not, specifically looking at phone and digital and virtual clinics, for example. But unfortunately, some of them have been far less positive, and it's discouraged people, especially women, for maternity services to come and seek help and also get advice for their pregnancies. I understand completely the worry. I know that a recent NHS survey has shown that most people try and avoid coming to the hospital so that they don't burden the services. And then a lot of people are, of course, scared of getting COVID-19 and giving it to other people at home who may be quite vulnerable. But what we need to say to women is that it is safe for you to come to hospital. All the measures that have been taken to keep everywhere safe by the midwives and the doctors, and everybody working in the hospital, we want to encourage women not to ignore symptoms and make sure they come to hospital, because we want to avoid any bad outcomes. Be assured that each hospital has taken the right precautions for protective equipment, for testing. Every single woman that comes into the hospital now gets tested. All the areas are, we try and clear out and spaces so that people have got enough social distancing between beds in bays, for example. And of course, if you have any concerns, it's always really important to speak to your midwife or your GP to get familiar with what's going on in your local maternity services. It's understandable that we're all worried about catching COVID, and especially if you're from a group that's even higher risk, like the Black and Brown communities. And we know that specifically when women from that community get COVID, they may become a bit more sicker and need a bit more medical help. So it's quite understandable. There is no evidence at the moment to say that COVID disproportionately affects pregnant women. Now, the issue is also that if you are from ethnic minority, Black or Brown minorities, it's really important to make sure you don't miss your scans, you don't miss your appointments, because I understand some people don't want to come in because of the worry about catching it. But it's even more dangerous to miss your appointments so that in case we miss anything serious in your pregnancy, and then you come with a complication. We know that the rates of complications in Black pregnant women are much higher, and there's more worry. And that's why I really urge these women to make sure that they don't ignore symptoms. So for example, if you're having a little bleed, or you're having a headache that doesn't go away, or you're not feeling your baby move as much, don't put it down to any other excuse. There's always somebody to call. You can always call your midwife. You can go and just use the NHS online service, the 111. You can call your GP. It's always better to check. And if at all you're extremely worried, the best thing to do is to come in and get checked out. It's much safer to do so than to leave these symptoms and not act on them, and then something untoward happens at a later stage. So you have to look at different NHS trusts or hospitals, and different maternity services have got different demographic, different types of women delivering, different staffing levels. So each one doesn't necessarily act independently. We all work together, but all of them need to be guided on who they need to serve, right? So under the new NHS guidance, recently, it's really, really important to complete risk assessments and make sure that the space physically is able to handle things like social distancing, the staffing levels are right, and also that we're taking all the right precautions to stay safe. And so you'll find that certain maternity services, their waiting rooms might be smaller than others, for example, so therefore you can't have too many people in the waiting rooms. So there's little things like that that need to be assessed constantly. And one of the things that's really important is for women, I know for sure in my practice recently, it's been really hard for certain women because you can't have your partner there all the time. Now, under the new guidance, you are able to have your partner there. We do support having your partner there in labor because you need that support, physically, mentally, emotionally. So it's really, really important for the partners to be there. And I think that scares a lot of women. And again, they avoid coming into hospital because they think their partners can't be there for them. But what's really important is to have a good communication with your midwife. Your midwife will be up to date with what's going on in your maternity services, and she'll advise you and tell you what's available and what's not, and so that you can tailor and plan your visit to the hospital when you come to have a baby. Partners can come to the birth. Of course, they have to make sure that they wear their masks and make sure they keep their distance. I mean, each woman would have a room to herself, so we don't expect you to kind of be out of the room and walking around a lot. So it's really important as well that partners respect the rules and the guidance, and that's really to keep everybody safe, as well as keeping the mum and the baby safe as well. But yes, partners can come to the hospital to be with their partners having a baby. Yes, so just because you've had a baby, your care doesn't necessarily stop just after having a baby. You're still supposed to have postnatal appointments and postnatal visits from the midwife. Of course, it's always individualized and it depends on your needs as well, post-delivery and for your baby as well. You will definitely have a postnatal visit. And the important thing is before you get discharged from hospital, to make sure that you speak to your midwife and know what the arrangements are so that you can also keep tabs on it. But the midwife should give you a visit or one of the maternity postnatal team to make sure that you're settling fine and that your baby is fine as well. Sometimes in some cases, if there's worries about COVID, this can be done virtually, so through video or through phone call. But of course, that's just it depends at the discretion of what's your situation and what the midwife's situation is. But there's always definitely a postnatal visit. If you develop symptoms of COVID or you think you've developed symptoms of COVID, the first thing to do is to book a test. So that's first and foremost, because we have to remember sometimes it might just be the sniffles or the flu, which we've kind of forgotten about recently. Everything is COVID until proven otherwise. So first and foremost, book a test. And then you can contact your midwife. So a lot of pregnant women have got their pregnancy book. And in the front of that book, it's got all the important numbers that you need to call. So you would call the midwife, or even if you can't get through to the midwife, you can call the labor ward, which is a 24-hour number, and ask for advice. If you've got symptoms, usually they'll record, and you're not going into labor, for example, you would be required to do the isolation as per national guidelines. If you're starting to go into labor, then that's a different story, and you can't stop labor from happening. So even if you've got COVID symptoms, you will come into the hospital and we'll take care of you and make sure that all the right precautions are taken. If it's outside having labor, then we can arrange for video consultation within the 10-day period of isolation. We'll check in with you, making sure that things like the baby's moving, you're not having any other untoward symptoms, just for the isolation period, and then we take it from there. But it does not mean that maternity services stop just because you're positive for COVID. Things still go on. The maternity services have been ongoing throughout the pandemic because they're an essential service. They will never stop.
It's that little get-out word. It's just a routine checkup. It's probably just normal. Just see how I feel tomorrow. For the health of you and your baby, it's important that we keep in touch. So if you're due to see a midwife or something doesn't feel right, your NHS is here to see you safely. Just speak to your midwife or maternity team.
Watch out symptoms, very important. When you are pregnant, one of the things we always ask about is the baby moving and how the movements are. Now, every baby moves differently. Some babies are active during the morning, some at nighttime, some after you've had a fizzy drink, for example. So it's really important to keep an eye on your baby's movements. And if you feel that the movements have changed drastically or changed in pattern to what you're used to, we need to know about it. It's really important because it's a very subtle sign, but it's also a sign that depends on you and what you feel. So it's that's one of the most important things to keep an eye on. And the other thing is things like bleeding, even if it's spotting little drops of blood that you think it's not that, it's nothing abnormal for you. It's really important to get that checked out. Do not ignore any of those things. And things like a headache that just doesn't go away if you've drank enough water and you've maybe taken a paracetamol and that headache still continues. A lot of people think that it's just related to stress or not sleeping, which it could be, which would be fine, but it's really, really important to make sure that it's not anything more serious. So these are the things we ask women to just keep an eye on, keep tabs on. If you're at all concerned, you call your midwife. If you can't get through to your midwife, then as I said, it's the labor ward number on the front of your book, your GP, or the online service, the 111 NHS service as well, is all there to give you advice. And then they will give you advice on whether you need to come in to be checked out or advice on how to watch for those symptoms if they get worse. So I know that this is a really tough time for women having, being pregnant and going into labor. And I know it's really scary because of all the things that we constantly hear about COVID. It's just taken over our lives. The doctors and the midwives work tirelessly to make sure that they are safe. They keep the unit safe. They keep the mums and the babies safe with the right equipment, the protective equipment. Also with tests, everybody gets tested as soon as they come into the labor ward to have a baby. And now with the new guidance, we're allowed to have, you're allowed to have support. So your partners can be there to support you mentally, because that was one of the things we're finding really, really difficult, or women were finding really hard and very frustrating. Although we're in the middle of a pandemic, life goes on, literally. And also we are taking all the measures, all the right things that we have been advised to take to keep the service flowing as well as we can during these times. And I think having faith and staying safe is really important. Of course, taking in the national guidelines of washing your hands, wearing your mask at all times, making sure your partner does that and everybody else at home does that. And as I said actually before, one of the things that's great, a positive thing about this pandemic is how we're using digital services now. We're using virtual clinics and video clinics. So we're still keeping in contact with our patients. And yes, we can't physically touch the patients and see them face to face, but at least it's better than nothing. So I think we need to make sure that we make the most of that and that our patients also know that we're making the most of that as well. So with the Help Us Help You campaign, what we want to tell you is that NHS services are here for you 24/7. The important thing is to keep up the communication with your midwife. Your midwife should always be contactable through a number on your pregnancy book. The labor ward is also contactable 24/7 should you not be able to contact your midwife. And failing that, there's the GP that you can also call during office hours, or the 111 service on the nhs.uk online service.